Hello, this is Dr. Drew Taft with Foot and Ankle Associates of Southern New Hampshire, and this is another Fast Foot Fact. This is our second video in a series talking about sports medicine injuries of the foot and ankle. In this video, I wanted to talk a little bit about our treatment options for these sports injuries. We generally follow the tried and true Rice method. It's often recommended as our initial treatment for most of these injuries. The R in the Rice represents the rest. And this is probably one of the more important things you can do for an injured foot or ankle, is to rest it and to avoid any of the activities that cause any additional pain or discomfort. This just gives the foot an opportunity to recover and allows whatever injury there was to start to rest and repair itself. If you continue to work through an injury, push it, then it just takes longer for your body to recover, or sometimes you can actually make the injury worse. The next step in the Rice is the ice therapy. Applying ice to the injured area can help with pain, but it can also help to reduce the swelling. We recommend generally in a frozen bag of peas or Ziploc bag filled with crushed ice cubes, something that's moldable, that can kind of wrap itself around the injury. And generally you make sure you're not putting the ice directly on the skin, using a towel or a face cloth to separate the ice from the skin. But rule of thumb is you're wanting to apply the ice for about 20 minutes at a time, alternating between ice and room temperature. Sometimes people will alternate between ice and heat, but the idea with icing is that the more that you can do this during the day, especially soon after the injury, the better you're going to manage that inflammation, that pain. So compression is the C. We use compression bandages, ACE wraps, anything that we can do to try to also help control swelling. Again, the more the swelling can control, the better the pain. The compression can also sometimes provide a little bit of support to the injured area. Obviously making sure that the bandage is never too tight. We don't ever want to create other injuries because of the tightness of the compression wrap. Elevating, another important one, again part of the Rice protocol, but elevating your foot or ankle can help to again reduce the swelling, which in turn helps to reduce the discomfort. We generally recommend that we want your foot or ankle to heart level or above. When it's up at that level, you're having gravity work in your favor by getting the swelling to gravitate away from the foot. When your foot and your ankle are below heart level, then gravity is going to work against you, and that swelling is going to continue to work its way down towards the injury. So outside of the Rice therapy, some of the other things that we do recommend are range of motion exercises. As we get through some of that initial inflammatory periods, we do like to try to get people back moving as quickly as possible. Motion helps to encourage healing. Gentle range of motion exercises helps to restore mobility and flexibility. Sometimes it's just as easy as drawing circles with your ankle or your foot, or oftentimes draw the alphabet. But all these things just to kind of help to encourage motion, reduce swelling, and try to get you back up moving quickly. Strengthening exercises is another good one. We try to improve the stability of the injured area and try to prevent future injuries by just helping to encourage you to start doing these stretching exercises. Sometimes these are calf raises, toe raises, ankle rotations. Some of these are just easy things that you can do. Sometimes we'll encourage TheraBands or other stretching bands to assist with this as well. And then that leads us to sometimes even formal physical therapy. Formal physical therapy can really help to develop more of a customized treatment plan that can really focus on recovering from the injury. They use a lot of techniques and modalities, including ultrasound, massage, more specific and targeted exercises that are really designed to help you get back to normal and back to your exercises and activities quicker. Great, thanks for watching. Stay tuned, we're gonna have another video that talks a little bit more about foot and ankle injury prevention. Thanks again.